So we will continue with the anti-epileptic. तो anti-epileptics के बारे में जब continue कर रहे हैं हम लोग, we need to understand one scenario that is your what pregnancy related. ठीक है, pregnancy से पहले जो भी drug of choice था will not. Okay, if a female comes to you with a सीजर तो प्रेगनेंसी है, तो क्या ये कंफ्यूजन, ये फंडा क्लियर करते हैं. तो आप लोग आधा गैनी में कंफ्यूज हो जाते हो, आधा फार्मा में कंफ्यूज हो जाते हो. तो लेट्स सॉर्ट इट आउट. ओके, सो कंडीशन नंबर 1. व्हाट इज दैट कंडीशन नंबर 1? द पहला कंडीशन आ सकता है, शी इज ए नोन केस, शी इज ए नोन केस of what? Known case of epilepsy. She is a known case of epilepsy from when? Even before the pregnancy. Even pregnant बनने से पहले भी, even if she before she was pregnant, epilepsy before the pregnancy, मतलब even before she became pregnant, she knows that she is a known case of epilepsy. That time the drug of choice pregnant female के लिए epilepsy होता है, तो that time drug of choice is your lamotrigine. Lamotrigine. Okay, earlier the drug of choice was carbamazepine, but latest update lamotrigine. ठीक है. Now what is the next important thing? If at all the female is a case of eclampsia, if the case is a eclampsia, so if the case is eclampsia, so that is the time you give the drug magnesium sulfate MgSO. ठीक है, तो eclampsia में क्या क्या होना चाहिए? eclampsia is a pre-eclampsia plus seizure, pre-eclampsia plus सीजर, प्री-एक्लाम्सिया प्लस सीजर. तो इसके अंदर प्री-एक्लाम्सिया के अंदर क्या क्या होता है? प्री-एक्लाम्सिया कंसिस्ट ऑफ हाइपरटेंशन एंड प्रोटीन. This is the story of your what? This is the story of your what is that? Pregnant female having to have a epilepsy, and this is the story of your anti-epileptic. So apart from all these things, so far in every one of the condition, you people noticed one drug common. That common drug कौन सी थी भाई? That was your sodium valproate. So this is like a trick. This is not a textbook statement. It's just a trick. Okay. If at all you are not able to figure out, what is the type of seizure, directly mark one. If you are not able to figure out, why? Because that might help you. Because many of the seizures will have what? Many of the seizures will have drug of choice में valproate as a choice of drug. Okay. So this is the story of your what is that? That is your एंटी-एपिलेप्टिक. तो एंटी-एपिलेप्टिक्स में आगे बढ़ने से तो तुम लोगों को वाइडली यूज्ड वन ऑफ दोस ड्रग वाज योर फेनाइटोइन. तो फेनाइटोइन causes some side effects caused by phenytoin. Phenytoin का side effects are very important. It can cause gum hypertrophy. Apart from gum hypertrophy, it can also lead to some problems such as megaloblastic anemia. It can cause megaloblastic anemia. Okay. Now at the same time, my dear students, look here. Valproate side effects are very important. Valproate can cause side effects such as weight gain करा सकता है. Okay. Weight gain के अलावा anything else? Yes, weight gain के अलावा it can precipitate or it can even cause PCOD possible. It can even lead to PCOD, and definitely nausea, vomiting are one of the common side effects associated with drugs. So this finishes your anti-epileptic drugs. So this is the story anti-epileptics के बारे में पढ़ लिया. So anti-epileptics हो गया. So what we are left out in our central nervous system? The things which we are left out in our central nervous system is very simple thing. They are your antidepressants and one of the most important ones, antipsychotics. Okay. So antidepressants and antipsychotics. Let's do it with the help of pictures. So that way it will be very easy and very rapid and short also. ठीक है. तो चलिए शुरू करते हैं. तो शुरुआत कहाँ से करें? So antidepressants, my dear students, we have a theory. Depression cure. The theory of depression is very simple thing. Depression occurs because of decrease of what is that? Neurotransmitters. Decrease of neurotransmitters such as norepinephrine and one more serotonin. So where exactly? In the central nervous system. So in the central nervous system, पहले बताओ norepinephrine is a derivative of which amino acid? Serotonin is a derivative of which amino acid? Both of them starts with tryptophan only. So एक हुआ serotonin is a derivative of tryptophan. Okay, and norepinephrine is a derivative of tyrosine. It is a question from biochemistry. याद करो, mark this question. Okay, let's continue. Okay, so basically depression क्यों होता है? Decrease of neurotransmitters. Okay, so basically what we are going to do, we have drugs such as SSRIs. What are SSRIs? SSRIs are nothing but selective. They are what? Selective serotonin reuptake. Selective serotonin reuptake inhibitor. Selective serotonin reuptake inhibitor. ये क्या करता है? Serotonin मतलब basically देखो guys, look here, wherever serotonin 5-HT मतलब serotonin जो रिलीज हुआ होता है ना, वो रिलीज हुआ सेरोटोनिन को रीअपटेक को इनहिबिट करवाता है. So basically what? Selective serotonin reuptake inhibitor will not allow, मतलब क्या करता है? सेरोटोनिन को वापस लेने को मना करता है. दे इनहिबिट करता है. तब क्या होता है? सेरोटोनिन का क्वांटिटी सिनेप्टिक लेफ्ट में ज्यादा हो जाता है. So that is the way we are treating depression. डिप्रेशन में प्रॉब्लम क्या था? न्यूरोट्रांसमीटर कम था. न्यूरोट्रांसमीटर कम था, लिख देता हुआ न्यूरोट्रांसमीटर. फिर कल कोई बोलेगा न्यूरॉन. तो न्यूरोट्रांसमीटर का ज्यादा हो गया 5-HT अगर ज्यादा हो गया तो वी आर ट्रीटिंग द डिप्रेशन. तो उसके अंदर क्या है? दैट इज गिवन. व्हाट इज दैट? सिट्रालोपाम, एसिट्रालोपाम, फ्लुओक्सिटिन, ओके, पैरोक्सिटिन एंड सेट्रालिन. Fluoxetine, paroxetine and sertraline. My dear students, fluoxetine is a drug which can be used where it is also used in one more condition. What exactly is that? That is called as psychogenic. Psychogenic. What is that? Psychogenic premature ejaculation treatment. What is the most common cause of pre-ejaculation? Most common cause of pre-ejaculation is psychogenic. Forensics से पढ़ लिए होंगे आप लोगों ने. तो that is what your pre-ejaculation का treatment. Okay. Then we have SNRs, serotonin and norepinephrine. Means what? They inhibit serotonin and norepinephrine. दोनों का reuptake को inhibit करता है. That is your what? That is your duloxetine and valnafaxine. What is that? Valnafaxine. And we have most importantly, which inhibit all neurotransmitter reuptake, that is your tricyclic antidepressant. So basically tricyclic antidepressants are used for the treatment of depression. ये क्या करता है? कोई भी तरीके का न्यूरोट्रांसमीटर को रीअपटेक से बंद करवाता है. What they will do? Let me repeat it in English again. So tricyclic antidepressant will inhibit the reuptake of all neurotransmitters, and that's how we are treating the depression. The drugs include amitriptyline, okay, imipramine, okay, nortriptyline, okay, and we also have trimipramine. What is that? Trimipramine. These are the drugs which are tricyclic antidepressant. So फंडा बहुत सिंपल है एंटीडिप्रेसेंट का. खत्म कर देता हूँ फंडा. दैट फंडा इज वेरी सिंपल. आई डू इट बोथ हिंदी इंग्लिश. तो पहले शुरू करते हैं हिंदी में. तो डिप्रेशन क्यों हो रहा था? न्यूरोट्रांसमीटर की कमी, मतलब न्यूरोट्रांसमीटर की कमी होने की वजह से. तो नाउ व्हाट वी आर डूइंग, वी आर ट्राइंग टू इंक्रीज द न्यूरोट्रांसमीटर. तो वो न्यूरोट्रांसमीटर को कैसे इंक्रीज कर रहे हैं? बाय यूजिंग SNRIs, SSRIs और ट्राइसाइक्लिक एंटीडिप्रेसेंट. तो उन तीनों में टारगेट क्या हुआ? न्यूरोट्रांसमीटर का क्वांटिटी बढ़ा दिया. तो हमें इतना ही याद करना क्या है? बाय थोड़ा मुश्किल है ड्रग्स. This is the point where you need to step up and buy at the drugs repeatedly. 2-3 बार देख लो repeatedly, टारगेट समझ लिए तो ड्रग आराम से अपना आप याद होता है. And tricyclic antidepressants are the ones which you should never ever forget. You should ever forget, क्योंकि tricyclic antidepressant का बहुत सारे uses हैं. Other uses of tricyclic antidepressant, other uses are nocturnal aneurysms. Nocturnal aneurysms means what? Usually bedwetting को ट्रीटमेंट करने के लिए भी we can use tricyclic antidepressant. migraine prophylaxis. For the prophylaxis of what? Migraine. For the prophylaxis of migraine. So write down migraine prophylaxis के लिए we use tricyclic antidepressants. Yes, we use propranolol. We use propranolol. Okay, both of them are used where? Both of them are used in the treatment of what? Treatment of your prophylaxis of your migraine. Okay, and they can be considered in an anxiety state and also for the neuropathies. Also for the neuropathies. So this is a very short topic of antidepressants. ठीक है, तो अभी मुझे ना ऐसा पढ़ाते पढ़ाते एक डाउट आ गया. What is the doubt? The doubt what I got was, for example, a patient came to you with trigeminal neuralgia. Trigeminal neuralgia. तो क्या? तो अकॉर्डिंग टू माय लॉजिक न्यूरो प्रोटेक्टिव ड्रग तुम लोग गावापेंटिन दे दोगे, ऐसा नहीं देना चाहिए. तो ट्राइजेमिनल न्यूरॉलजिया और एनी न्यूरॉलजिया के लिए ड्रग ऑफ चॉइस यू नीड टू रिमेंबर दैट कम्स आउट ऑफ एंटी एपिलेप्टिक ड्रग ओनली. उसका नाम है कार्बामाज़ापिन. कार्बामाज़ापिन. ठीक है, सो दिस इज द स्टोरी ऑफ योर व्हाट इज दैट ट्राइजेमिनल न्यूरॉलजिया का ड्रग. The patient came to you, a 25-year-old male came to you with the complaints of what? Shooting pain in the face. Okay, suspected of trigeminal neuralgia. What is the most likely medication to be given? What is the best medication to be given? आंख बंद करके दे दो भाई साहब, कार्बामाज़ेपिन. खत्म हो गया कहानी. चलो फिर आगे बढ़ते हैं. लेट्स प्रोसीड फर्दर. द लास्ट एंड मोस्ट इंपॉर्टेंट टॉपिक ऑफ सेंट्रल नर्वस सिस्टम वो है तुम्हारा एंटीसाइकोटिक ड्रग्स. सो बेसिकली एंटीसाइकोटिक ड्रग्स, व्हेनेवर आई एम टॉकिंग अबाउट एंटीसाइकोटिक ड्रग्स, आई नीड यू पीपल टू अंडरस्टैंड सम बेसिक्स. सो साइकोसिस क्यों हो रहा था? So psychosis क्यों हो रहा था? What is psychosis? What is neurosis? You people should be able to understand. Okay. So let's come to this. But before going there, I want you people to understand what exactly is, my dear students, psychosis. इसको इधर खत्म कर देते हैं. Let's use this space. So basically antipsychotics we are starting. When we are talking about antipsychotics, I want my doctors to understand क्या है? What is psychosis? What is psychosis and what exactly is neurosis? ठीक है, तो आप लोगों ने ना साइकोसिस न्यूरोसिस को मजाक मजाक में लिए होंगे, ज्यादा पागल कम. तुम्हारा ट्रिक यही है. So your trick is what? He's heavily mad and this is less mad. No, not like that. Neurosis is a condition where patient is aware of his illness. Patient is aware of the illness. मतलब what? He is aware of the illness and he is willing to take the treatment. Psychosis is what? Patient is not aware of illness. Patient is not aware of illness and he is having maybe agitation, etc. Anything that is called as psychosis. Okay, so if I want to treat any patient with psychosis or any psychiatrical condition such as schizophrenia, etc., so what we have to do, my dear doctors? So what we have to do is basically block the dopaminergic receptor. Block the dopaminergic receptor in the central nervous system. So if I'm blocking the dopaminergic receptors in the central nervous system, so psychosis can be treated. So what are the antipsychotics we have? The antipsychotics which we have here are called as typical antipsychotics and another ones are called as atypical antipsychotics. So what are these typical antipsychotics? These typical antipsychotics are very much, pretty much they are non-selective in nature. They are non-selective in nature. They're what nature? Non-selective in nature. What do I mean by non-selective in nature? My dear students, it's very simple. Our target was to block D2 receptor only. But look here, they block M3, they block H1, they block alpha 1. They're blocking numerous receptors. That is why that is called as very much non-selective. But when you look at a typical antipsychotics, D2 receptor and only 5-HT2, they are very much selective. They're more selective. They're more selective to the dopamine receptor. मतलब दूसरे receptor को ज़्यादा लोगों को छेड़ता नहीं है. That is your atypical antipsychotic. तो typical antipsychotic में कौन कौन है? Chlorpromazine. Repeat करो. Chlorpromazine. Okay. Haloperidol. Droperidol. What is that? Droperidol. And we have last drug that is called as Thioridazine. So these are the drugs which are what? तुम्हारा typical antipsychotic. Typical antipsychotics क्या है भाई? नॉन सेलेक्टिव इन नेचर है. उसके अंदर कौन कौन आता है? क्लोरप्रोमाजिन, हैलोपेरिडॉल, ड्रोपेरिडॉल, थायोरिडाजिन. ठीक है. तो what is the most important aspect? This is a fact based question which you have to by heart. This chlorpromazine can cause a side effect that is called as a cholestatic jaundice. That is called as cholestatic jaundice. Cholestatic jaundice. That is the story of your typical antipsychotics. चलो फिर नया वाला एटिपिकल्स के देखते हैं जो सिर्फ और सिर्फ डोपामिन की तरफ ज्यादा स्पेसिफिक है. तो कौन कौन है? क्यूटियापाइन. हाँ, गलत मतलब नहीं सुनो. That is called as क्यूटियापाइन. क्यूटियापाइन is a drug which can cause side effect as a cataract. We have one more drug that is called as clozapine. Clozapine and clonazepam confuse मत होना. Clonazepam is a benzodiazepine. Clozapine क्या है भाई? Clozapine is a antipsychotic. Clozapine can lead to one side effect called as agranulocytosis. And we have one more thing that is olanzapine. Olanzapine is the best drug. If a female is having psychosis during the pregnancy, we can use olanzapine. And even more latest drugs are risperidone and ziprasidone. So clozapine के one more important side effect that is called as it can cause wet pillow syndrome. QP because of 5-HT2 blockade action, wet pillow syndrome. And most importantly, it is a drug of choice in resistant schizophrenia. Resistant schizophrenia मतलब we started, for example, I have a patient with schizophrenia, pseudo hallucination लेके आ गए, schizophrenia diagnose कर ली. करने के बाद क्या हुआ? उसको हैलोपेरिडॉल दिया, ड्रोपेरिडॉल दिया, सब कुछ दिया, काम नहीं कर. तो उसको उठा के सीधा काम फेंकोगे. काम को कौन सी ड्रग में फेंकोगे? मतलब पेशेंट को नहीं फेंकोगे, पेशेंट को कौन सी ड्रग दोगे? दैट इज योर क्लोज़ापाइन. सो आई एम टेलिंग यू, रिपीटिंग द क्वेश्चन अगेन. देयर वाज अ पेशेंट हु इज अ डायग्नोस्ड केस ऑफ schizophrenia. Okay, his typical pseudo hallucinations are there. Now he's resistant to haloperidol, droperidol, both of them. Now what will you do? Just you shift the patient to clozapine. Clozapine will give you a proper help for the drug resistant schizophrenia. Okay, and one of the most important drugs which I want to discuss with you people, what is that? Mood stabilizer. What is that? Mood stabilizer. The mood stabilizer is one of the MCQ drug, I can say. The drug is lithium. Why we need to understand lithium? I'll tell you people. The reason is mood stabilizer, lithium. Lithium is a drug which is used usually in mania condition. And one more thing, bipolar disorder. People will be used to. तो मूड को स्टेबलाइज करना. तो ये लिथियम के बारे में क्या जानना चाहते हो? तो लिथियम नीड्स ड्रग मॉनिटरिंग. ड्रग मॉनिटरिंग मतलब क्या है? थेराप्यूटिक ड्रग मॉनिटरिंग को मतलब क्या है? वी नीड टू check the levels of lithium in the bloodstream always. So that is what is required for you people. And apart from that, lithium can also cause nephrogenic diabetes insipidus. So this is the story of your central nervous system. So after central nervous system is done, rest everything whatever is there with the clinical case scenarios, I'll be getting on to that, and I'll give you people exact orientation with the topics, because there are few topics which are very boring, such as your chemo and antibiotics. ये दोनों को I'll give you people a proper information with the clinical case discussion, so that you remember and solve all the questions. That's the target. Okay, thank you.